Neil Trautwein is with us, and he is involved in this effort called Stop the Hit, Health Insurance Tax Coalition, that has gone into high gear because they are very concerned about jobs across the country and in the state of Connecticut as a result of this health insurance tax. Neil, thank you for joining us today here on WATR.
Thank you, Larry, and good morning.
Good morning. So tell us, what is the health insurance tax? I mean, we've talked always around the health reform bill, but there are so many facets to it that this one has not come up for a lot of conversation. What is it?
This is a tax on insurance premiums that will be paid primarily by small business because they buy the fully insured product. But literally, it's a tax on premiums, about $100 billion over 10 years.
Okay, so this is in the Reform Act.
It is indeed. It's one of the ways of paying for it. One of the specific industry taxes. This one worries us a lot because it's taking something that we want and need, which is health coverage, and making it more expensive.
Okay, well, I mean, who said this was going to be affordable? I mean, this is one of the biggest misnomers I've ever heard, honestly. But let me ask you, when you're talking about the jobs that may be lost in the state of Connecticut as well as across the country, give us the impact as you see the landscape here in Connecticut.
Well, we've seen some estimates that nationwide it's between 125,000 and 249,000 jobs over 10 years. In Connecticut, it could be, we're projecting a per-person increase over 10 years again of $6,339. But in a state like Connecticut, when you're trying to boost employment, when you're trying to navigate a complicated law, putting additional cost on the premiums doesn't help anybody and puts jobs in that unaffordable.
Okay,
category.
wait. You're saying per person we would be paying an additional, was it 6,000 something?
That's over that 10-year period.
Oh, over the 10-year period.
Not all. No,
oh, okay, okay, right. Okay, you brought me back. I didn't need the smelling salts. Bill Millerick, the president of the Greater New Britain Berlin Chamber of Commerce, called HIT a really big issue. I don't know why we didn't hear more about it during the campaign. I wonder. Michael Nicastro, he's the president and CEO of the Central Connecticut Chambers of Commerce, also weighed in on the HIT in his weekly column. You've got a lot of support. You've got a lot of folks in Congress already who have woken up to this. And how many co-sponsors do you have on a bill to repeal this?
We've gained 227 co-sponsors in the House. That's Congressman Bustani's bill. In the Senate, it's been a little slower. We have 24 out of the 100 senators on the bill. But we think that it's a big bill. It's a complex bill. People don't understand it. But when things like this stick out and really get to people, then I think we have a much better chance of pulling this offending tax out of there.
Okay, well, you've got this one, then you may have some others that others would like to pull out, but this one has bipartisan support. So you've got Democrats and Republicans signing on saying, oops, in the 2,000 pages, we must have just had an oversight or maybe fell asleep when this section came up, so we just missed this. But, how noxious would this be? Because small business is already very worried. I mean, we're hearing that a lot of small businesses are going to take the fine if they've got, I hate to use the term low-value employees, but by that I mean if they don't have to really fight and claw for some really high-end, technologically savvy, extremely educated folks in their workforce. So I'm talking about some service workers. Then they might say, look, I'll pay the $2,000 fine and let everybody go on to an exchange. So we're already hearing that, the small businesses are trying to figure out their strategies in dealing with this new law.
You're exactly right, Larry. The law applies fines for companies with 50 or more full-time employees and changes the definition of full-time to 30 hours per week on average. That's a big problem. But for businesses who are under that level, who are not fined, these are the companies who have been coming to us for years upon years and saying, how can I provide coverage? And if the answer is taxing health coverage and making it more affordable, I think those folks are going to be left wanting.
Okay, so just to be clear about this, this falls on those employers, equally, who have fewer than 50 employees. I mean, many people felt that they were kind of left out of this health care requirement, but you're saying that this hit tax not only hits those 50 or more, but hits those under that who, as you say, have wanted to provide, health insurance for a number of their employees if they have 3 or 4 or family members or whatever. You're saying it hits them as well.
It does indeed.
Okay. So where do we go here? I mean, what are we going to see? I mean, I haven't heard much discussion about this. I mean, you guys seem pretty well organized, and a lot of people are kind of waking up to this. But, is this something that we're going to see in this session of the Congress? I mean, starting in January, are we going to see a big pushback then?
I think we will begin to in much the same way that we repealed the 1099 paperwork mandate in the last Congress.
Yeah, remind people of that.
And that was a provision that required you to provide paperwork to everybody you did business with. It was essentially the paperwork blizzard. Mm-hmm. And that's an area where nobody owned it, and that we successfully helped Congress repeal it. We hope we're going to be able to do the same thing on the health insurance tax in the coming Congress. But there are a lot of stuff coming. When I talk to my members, I call 2014 the Freddy Krueger year because it's that scary.
Now, tell me some of the other things that are scaring you, like Freddy Krueger would if you saw him in front of you.
Really, the mandates are very, very bothersome. Not only can you be fined if you don't provide coverage if you're the right size, but you can also be fined if you provide coverage and it fails to hit some income guidelines. In addition, there are, in your last segment, you were talking about the benefits that are offered. I had a coalition that works on trying to keep that benefit package more affordable. But there is a massive, massive effort. We're working with the administration to try to smooth the rough edges out, but there is so much more of this law than people have seen, and the health insurance tax is just the tip of the iceberg.
Okay, well, this certainly has gotten the attention of so many. If small business folks are listening to this program, as I know they do, and they want to help you out here, they want to sign on in any way they can, or go to their own legislators, even within the state, and push them to push the federal guys or their own congressmen, what should they do?
They can come to the web at Stop the Hit on the web. In addition, we, the Retail Federation, have a website that at www.retailmeansjobs.com/healthcare, and there are a lot of good materials there.
Okay. Whoa, what happened to Neil? Well, thank you, Neil Trautwein, Connecticut Jobs. He's the VP of Employee Benefits and Policy Counsel for the National Retail Council.